you know that the way that you take care of your mouth, your teeth, and your gum can affect the overall pattern of your general health? We are learning more and more how oral care, your oral microbiome, which is the bacteria in your mouth, can affect both locally in the mouth itself and can lead to things, unfortunately, like heart disease, diabetes, obesity, brain fog, potentially Alzheimer's now. So we want to give you some tips here on how you can optimize and what to look for in terms of your oral health to optimize your general health as well. So here are the things you need to know. Number one, in terms of your mouth health, we're looking at a lot of different factors that are going to potentially down the road affect your general health. We're going to look at your gum health. We know that gum disease and gingivitis and even the inflammation itself can lead to heart disease. That bacteria can colonize the heart and lead to decreased heart function and potentially heart damage down the road. It can also lead to diabetes. So you want to make sure that you're taking care of your gums, and we'll go into that in a little bit later. We want to make sure that the microbiome, most people know about the microbiome in your gut, your intestines. There's also a specific microbiome group of bacteria in your mouth that you want to maintain. You can actually now test the microbiome and the bacteria in your gut. There are certain tests out there where we can see, do you have normal levels of these bacteria that you need to have good health, or are your levels too low? That's the first thing we want to look at. Next thing that you want to do is you want to making sure that you're performing the right things to make sure that microbiome stays healthy and good, just like you want to do prebiotic foods for your gut. You want to make sure that you're not taking what are called proton pump inhibitors or acid blockers that limit them as much as possible. It's going to limit the nitric oxide and other chemicals in your mouth to have a normal microbiome, the normal gut amounts you need in your mouth. You want to make sure that you're not using fluorinated toothpaste. There are brands out there now that are not fluorinated and can help optimize the oral health and optimize the microbiome in your mouth. You want to make sure that you are not using fluorinated or toxic mouthwashes. Most traditional brands out there are damaging the microbiome in your mouth, and they're decreasing the amount of nitric oxide which you need to have a healthy mouth organism as well as healthy mouth microbiome. We're looking at inflammation throughout the mouth, not just in the gums. You want to make sure that that is healthy. You want to make sure that you are flossing daily. You want to make sure that you're optimizing the microbiome of your mouth. You want to make sure that you are tongue scraping. Tongue scraping can help decrease the bad bacteria that's on your tongue that can lead to gum and other infections. You want to make sure that you're seeing the dentist regularly. The dentist is going to be able to remove that harmful plaque. Make sure that that doesn't lead to inflammation of your gum, and doing what you can at home to prevent cavities as well, because that can lead to problems with your health in your mouth, but also general oral health. We talked about optimizing the microbiome in your mouth. We talked about making sure that you are doing things that you have to protect the gum and limit any episodes of gingivitis. We talked about making sure that you care for your teeth as well, making sure that you are not ingesting products that are going to not only affect the health of your mouth, but now we know may actually lead to other issues in terms of your systemic health, things like diabetes, obesity, Alzheimer's disease. And we now are doing these tests routinely to see how people are doing to make sure that we can prevent these types of issues as opposed to having to deal with that on the back end. Other things that we're looking at in terms of mouth health, having appropriate moisture and hydration. We know dryness or mouth breathing can lead to abnormal buildup of bacteria. So we sometimes will advocate for optimizing nasal breathing. Things that you can do to help that would be using mouth taping. Mouth taping is something that you have to get used to. You want to find a mouth tape that you feel comfortable with. You don't need something that's going to literally tape your mouth shut. There are mouth tapes that are much more localized in the central area of your mouth. That has been shown to help optimize not only organization of your mouth, nasal breathing has been shown to help other issues as well. Snoring, sleep apnea, chronic fatigue. You want to make sure that you're doing all those things, other issues that we get questions about. Optimally, you would like to try to remove any metal amalgams or any metal fillings that you do have. There is an increased risk now for potentially having some autoimmune issues. Also, it does breed inflammation and bacteria growth. That is something that you do want to go through a holistic dentist or somebody who knows how to remove those amalgams in an appropriate way and has access to using holistic methods to replace them. You want to make sure that you are doing all those different things optimally to help your oral health. Then there are things that we use more in a general fashion. Oil pulling. The solution usually is some type of coconut oil. There's plenty of great brands online. We'll link to some of them in the comment section. You want to do it anywhere between 5 to 15 minutes, at least 3 to 4 times a week. This helps decrease inflammation. This helps remove the bacteria that can lead to cavities and gingivitis. So great on all accounts. There are products called dental sidin, which actually is a liposomal formulation where it actually will go in there and again will remove biofilms, which will help protect infections from being removed. I've talked about red light in almost all my videos, all my social media. There's now specifically red light for your mouth. It's been shown to help decrease inflammation if you have TMJ, if you grind your teeth at night. It also will help improve gum disease. It's something that has no medication, no side effects. And those Guardian and Guardian Plus, a really great product, very simple to use, not something you need to use every day, but something that will help to really maximize your oral health. Stay tuned for more tips on how you can optimize your health and supplementation in the next videos.